So the plan would be to do that wrist replacement like we spoke about. The primary reason for doing it is to take away the pain while at the same time giving you motion. Okay? And also you have some arthritis here at the joint between these two bones, and so we're going to cut back on this bone as well to decrease the pain that you'll have between that joint also. There's a nerve that runs along the backside here that sends a signal to your brain that's basically tells you you have wrist pain. And so what I'm going to do is I'm also going to trim that nerve back a little bit so that you don't have as much wrist pain. That's pretty much it. So I'm going to replace that joint. I'm going to remove this part of the bone here that's giving you some trouble as well, and then also trim that nerve back so you don't feel as much pain. After surgery, you'll be in a wrist splint, and then we'll see in about 2 weeks or so. We'll take you out of the splint, we'll put you in a wrist brace, and we'll get you started on some therapy so you can start moving your wrist right away. More pain is in the first 6 weeks or so, but realistically, the first 2 weeks are the worst. And after 2 weeks, you'll feel better. You'll still have some discomfort, but the expectation is in about 2 or 3 months, you'll be able to use the wrist fairly normally. You just want to be able to lift heavy things, but you'll be able to use it to assist the other hand.
Okay. And it'll take kind of the pain from here too because of down there?
The back of the hand.
Yeah. Okay. And you're going to take that dead bone away. I'm still trying to figure out how it died.
All right, very good. So we'll plan on doing that. And at home, remember to keep the fingers elevated, keep the fingers moving.
Okay.
Put some ice on it, it'll help with the swelling.
Okay. And I got to wait 2 weeks to go back to work.
What do you do for work?
I'm a security guard. I do computer.
Yeah, so for computer work, 2 weeks is reasonable. But if you're going to be holding someone, you probably
No, it's just
computer work.
computer.
Yeah, 2 weeks sounds reasonable.
Okay.
All right, I'll see you in a little bit.
All right. It's doing great. Not much pain, a little bit of pain. Not much now. I'm able to move it some, take the brace off a little bit and move it. I went back to work after 2 weeks. In the beginning, it was pretty painful the first few weeks, but then after that, it started slowing down. And I really haven't had much problems with it. I can bend it a little bit. I can bend my fingers some. I mean, it's a lot better than it was beforehand. So he was a really good doctor.